Aloha! It is Thursday, and today's show is the Hawaii Food and Farmer Series. I'm your host, Justine Spiritu. Thanks for having me back. This is my co-host, Matthew Johnson.
Thanks, Justine. Great to have you back.
Yeah.
It's been so long.
Yeah. So just to recap, this series is about bringing our farmers and all the individuals and organizations that are a part of our local food system, getting their background, seeing what they're working on, seeing how it all fits together, and getting some of those backstories. So today we are lucky enough to have Tina Tamai from the Department of Health. Thank you so much for joining us.
Thank you for inviting me.
Yeah. And so, Tina, you are the Nutrition Education Network Coordinator.
Yes.
Okay. And I first heard about you and the work you're doing with the coalition Live Better Together. So if you can kind of explain what the goal is of that coalition and how that sort of formed, that can get us started.
Okay. The goal of that group is actually to increase access and also to promote healthy eating amongst low-income populations. So what we found as we were doing our work is that in order for people to eat better, they also need more affordable access and more availability. So those two things came hand in hand, and especially for low-income populations because they are the ones at highest need, and really they can't afford fruits and vegetables as easily. So in order for us to enable them to eat better, we needed to work on both issues, increasing access and also to get to be more aware about eating fresh fruits and vegetables and incorporating more of that into their foods.
And that's an interesting inherent challenge that you're taking on because I think anyone who's familiar with like local ag products, they typically tend to be more expensive, even though we know that those are the freshest and healthiest food to have. Mm-hmm. And then when you're trying to match that up with these lower income populations, because you have that challenge because on one hand you want to really support the farms,
right? And
we need to get them as much return on their investment as possible, and then like you said, providing this access. So what are some of the conversations that you're having or some maybe pilot projects that you're looking at?
I think when we first started out, because this was part of the SNAP-Ed program, which is funded by USDA, and the goal of that program at first was mainly nutrition education. So they just want to give people information about how to eat healthier and what you should be eating, that kind of thing. And as we started to work, what we found is that's not enough because we're actually targeting obesity prevention and chronic disease prevention. And it's not enough just to tell people to eat healthy. You have to find a way to get them to actually try it, to eat healthier. And then we start to realize if you tell people to eat fruits and vegetables, they have to have access to it. Yeah. And so then it opened up a whole Pandora's box of issues to deal with, because what you start to realize is the food system and the whole thing about how we get our food and access is a really complex system. So really what it comes down to is ideally we would want to have local foods available for everybody. Right now I think what I'm seeing is that farmers are having a hard time. There are some of the fruits, it would be ideal if they could provide all the fruits and vegetables for us, but that's not what it is at this time. And I think what we found is that if we can work with the populations and with the different sectors that are involved in the food systems and try to get them to beef up and increase demand, that will support the local food system, and in turn they will be able to grow more and have a more sustainable market, and at the same time then support the people that have the demand and want to eat more fruits and vegetables. So it kind of goes in a cycle, in a circle. It's really integrated, it's really complex.
Well, and then when this initiative started, did you know it was such a complex thing? When you kind of talk about the goal of SNAP-Ed, if you want to go back a little bit, if this is kind of a federal initiative that then gets trickled down. So you guys the Department of Health took that on, and in the process of trying to implement it, you kind of saw whoa, we got to come up with a new approach.
Right.
So how old is this initiative, and are you the first person in this position to kind of be the coordinator?
At the Department of Health, I am. So I began this project about 10 years ago, and it started out, the USDA was actually just targeting nutrition education, what's called direct education. So what they would do is, get a bunch of people and kind of give them a series of classes of how to spend thriftily and how to, eat well, how to preserve your food safety, that kind of thing. And when the obesity problem grew, and of course now we have a huge hunger problem, the USDA started to switch their direction and strategies and start to realize it encompasses the whole food system. So now USDA allows us to, or they actually want us to move beyond just giving information, but to actually help support communities to build a whole better food system so that you have access and they're more aware and you're supporting farmers and just making the whole system better so that fruits and vegetables are like the norm and are available all the time. So it involves a lot of work in a lot of sectors, and it was
Sounds
an
like a big
eye-opener.
jump in expectation for your role. To like, here's a specific goal. Now, how about you just...
Yeah, was that in your job description?
But no, that is the aim of public health. I mean, that's how I was schooled in public health. And it was all about community organizing and get communities to really do it for themselves. And I think that's probably the better way to deal with this because it's such a complex problem. And every community has a different set of needs and a different set of wants in their community and the way they want to do it in their particular setting, that you have to be, broad and really, really thoughtful and supportive of anything that anybody wants to do, because it'll all happen. It's so complex. I don't think you can single out a single piece.
You can't just go after one. It's not a modulated thing.
No.
I think it's interesting too because you're starting to see like larger corporations with like wellness programs, and they're understanding the relation of the health amongst the employees within their organization. And then you also have healthcare providers that are starting to get out more into the community, like the Blue Zones project, which is
SA.
Make sure I have the acronym right.
Okay.
It's easily to mix them up. And so I think there's just more and more of that kind of larger holistic planning that you're really looking into. And it is hard, and it seems like so much to take on. But like you said, if you really want to have an impact in community health, that you have to address all these different things.
Right. You have to have everybody on the same page, which is huge. And then to create that awareness and to make it a social norm so that everybody's aware that, this is how you stay healthy and everybody needs to support it. So it involves all sectors of the community. Community people, like you said, the healthcare sector, insurers, retailers, farmers markets, the farmers themselves, because they're all intertwined and actually each supports one another, and you can't really do it without the other piece. So I think everybody has to work together, and we start to realize that. And so what we want to do is be inclusive and to include everybody, so we could build the system instead of working, in parts.
So do you want to name some of the organizations that you do have on board that are kind of sharing?
Do some name dropping.
So we've been lucky enough to work with some really great partners. We started out in Kalihi, and we're working with Kukui Kalihi Valley Comprehensive Health Center. And we've been at it. We were looking back at when we first started, and actually it was 2010. So it's now about 6 years in the making. Slowly just working with people in the Kalihi community, trying to get them to network and to support each other and kind of just share resources, because at the same time, resources and money were dwindling. And we found that if you just link people together, they actually can share duties and resources, and they make things happen a lot more quickly. So we started out there, and they eventually got a grant with CDC, which is the REACH grant, and they came up with the idea of a cultural food hub, which is great because in Kalihi there are 15 different ethnic groups there, about that many, and each one is in a silo, and a lot of the fruits and vegetables that they're accustomed to are much more expensive in Hawaii because they're not native to, they're not as prevalent. And so what they start to realize is if you want people to eat fruits and vegetables, you've got to start where people come from, what their native tastes are. And so what they're doing is they're trying to make those cultural fruits and vegetables more accessible and more affordable, and that's their food hub. And so they've developed farmers markets and at KPT Housing. They've done it in the schools and gardens. They've worked with the city and county and their People's Up and Market. They do gardening in the schools and in the community. They also have cooking activities. They developed their Roots Cafe. And they're integrating all these things at the same time now. And the feast community organizing training that we did kind of came at the right time, because now they're starting to organize the community, bring them together, and ask them, like, okay, what are the pieces that we need to make it better for Kalihi community? It's pretty cool.
Yeah,
it's
it sounds
really
awesome.
nice.
So then kind of with the lesson there, or with the state's kind of role in that, if you kind of elaborate, it sounds like different things are going on, but it took someone to kind of connect the pieces. And so, for example, you said the like access to the CDC funding. That's kind of like what this role is. I see from the emails, you send a lot of information about different grants that are available when you're talking about resources.
They found the CDC grant themselves because they're really good at it. But I think our role at the Department of Health is to see where the different pieces are, because I encounter a lot of people, and so I kind of see where the pieces are. And I think the greatest role we could do is provide is to support these different groups and to connect them, to make the languages, and also to provide grant opportunities. And I think as we grow this, we've got like community groups in a lot of different communities. I think we need to network even more, because now we're starting to all compete for the same grants, and I think we need to work together even more so that we aren't wasting time in competing with each other. So it requires a lot of integration, I think, and I think that's the neat thing about this kind of work.
Cool. You had mentioned briefly the feast aspect of it. Is that something that came out of this initial work with KKV, or give a little more background on that?
Okay, when the SNAP-Ed program started to move into policies and systems change and away from just providing direct education, we were getting stakeholder groups and leaders from different communities wanting to do food hubs and food systems and work in the community. And so what we wanted to do was provide them with some training. So we brought in the feast communities, food systems, community organizing training, which is provided by the Oregon Food Bank, just to provide the leaders of the communities with skills on how to organize their community.
It's kind of like a template.
Yeah, like a format, but just some skills, because I think that's the same thing that just as we're coordinating on a larger level, we need the community leaders to coordinate their community and to gather them and provide some direction so that they can actually vet out a system and make things happen. So that training was the start of it, and what we wanted them to do, each community member or leaders to do, was do that kind of a leadership and do some strategies for the community. And what we will do is try to support them to carry out those strategies and then link all the different communities together.
That's great. I think that goes along with your idea that you want to kind of empower the community to take the lead themselves. So we're going to take a quick 1-minute break, and then I want to hear some more kind of specific success stories from some of the organizations.
Okay, great. Thank you.
I'm Jay Fidel, CEO of Think Tech Hawaii. We work for the common good. We want to bring people together. We want to create a platform for civic engagement and raise public awareness. You can find us at thinktechhawaii.com. Thanks.
Hello, I'm Crystal from Quack Talk. I've got a new show here. You've got to tune in. Check out my topics on sensitive, provocative female issues. So Tuesday mornings, 10 o'clock. Don't miss it. It's going to be fun and dangerous.
Hello, I'm Patrick Bratton. Please join me every Thursday at 1 o'clock for Global Connections, where I talk to a variety of guests and range through many issues from contemporary, international, political events, things talking about national security, all sorts of international issues, and also more local issues, history, and so on. I look forward to having you join me and talking with some of my guests. Thank you.
Aloha and welcome back to Hawaii Food and Farmers Series. Today's guest is Tina Tamai from the Department of Health. She's the Nutrition Education Network Coordinator and leads the Live Better Together sort of group that is bringing together different organizations and individuals that are contributing to the food system with a specific goal of greater access, to healthy fruits and vegetables for low-income populations. But as we talked about, you can't get real specific without kind of getting a larger understanding of the whole system. So we talked about kind of a success story with KKV, a community that had a lot going on. You shared some resources and some trainings, and they've been able to put on some events. And would you say they've seen, and has this been successful in terms of access and awareness to?
Yeah, it's amazing. It really, with any kind of community or organizing project, it takes a long time. So it's been like 5-6 years. And when we first started, we're thinking, oh my God, this is like, people are going, why do I have to go to this meeting with Tina? And so, I mean, we just kept meeting, and slowly, I mean, it took some time because I think Hawaii has to do things its own way. The group began to grow, and all of a sudden when I go and see the activities that are happening in KKV, it's like so neat because they've gathered up farmers and community people, the schools and everybody, so they actually are making things happen in their community. And likewise with other communities too, they're starting to take off, and with some help and just linkages, they're able to do the same thing and create, you know, food hubs and better food systems in their community.
Yeah, it's great to see an example, and then you wanna do that in your own community.
Right.
And so with your group brings people together to kind of just share these success stories, and then
Provide them support.
And similarly, so you've seen that kind of shoot off in the other islands as well.
Right. We start to, when we start to see things take off in Kalihi, we thought, you know, we are the state Department of Health, so we need to work statewide. You know, I found some people on the Big Island, and the food basket in the Kohala Center, we got them to partner, and Young at the food basket had this vision of aggregating fruits and vegetables because he is kind of like the food bank at the Big Island, on the Big Island, and he has access to all the different distribution sites throughout the island, and he also has access to trucks. So he had this vision of, well, if the trucks are out there delivering, you know, canned goods and things, he might as well pick up fruits and vegetables on the way. And so he developed CSA boxes, got EBT access, and so now he's distributing all of these fruits and vegetables to communities throughout the Big Island. And the Big Island has a lot of people who are really have little access to fresh fruits and vegetables. So it's pretty cool. And the Kohala Center supports them with, you know, helping with grant writing and direction. And so they start to gather the stakeholders throughout the rest of the island. So they've got a really neat group of people going there too. So it's pretty neat. It's pretty cool.
And it's neat to see when people usually think of a food bank of having, you know, maybe not the healthiest food available, where it's like processed boxed canned goods, soda, and it's neat, and I'm familiar with and what they're doing at the food basket. I mean, it's great to see that they're seeing that they have all the infrastructure in place, and kind of moving in that direction of then doing the CSA and then operating as a food hub, as a way to leverage the infrastructure that's already there.
Right, and I think that's important because I think what we're trying to do is change the culture of food banks, and I think N is like an innovator because if you think about it, really, just because someone's low income doesn't mean that they shouldn't have access to the same foods that we all eat, and to stay healthy. And really, the whole point is to keep that population healthy because they impact the rest of our state and our economy and our society too. And it's really a matter of equity too. So if there's an opportunity to be able to provide those fresh fruits and vegetables, it's really important. And N was one of the first people to kind of think about that. Yeah, on the Big Island. So it's really neat. Yeah.
And then you're also they're on Molokai. I know you guys are talking to Harmony, where they're working on developing out a food hub, kind of its initial nascent stages.
Right. I think Harmony, you know, like this lone soldier with, I think, Jamie, her friend. The two of them are like really kind of creating their own food hubs on the island of Molokai. They just launched, I think, their online mobile cart.
Cool.
Fruit and vegetable ordering system and delivery. So they're doing that. They also do farm to school. They're trying to reach out to the community, and they do this Eat Local challenge. So they're kind of creating a food hub in and of themselves. And she's gone out and got training at the University of Vermont, and which she's
Yeah, I was at
wants to
that
share with
training with
everybody
her.
else. Oh, okay.
Yeah.
Oh, cool.
Yeah, yeah.
Okay, you need to come with and help us, because what we want to do is we just wrote you in, to provide
Oh, it's
this
on camera now.
information. Yeah,
It's visual.
to provide this information to the rest of people who are trying to create food hubs.
Yeah.
Because it's not just an ideal thing that you do. It takes a lot of work, and there's a business
yeah.
part to this. And in order to sustain it, people need to know the business end, because you're dealing on a low margin, a very tight margin. And if you want to sustain this for people, you have to know the business side of it.
Yeah.
Yeah.
And it's interesting too from Molokai. I mean, the opportunity there to grow is huge.
Right.
And
They actually could be sustainable, because the people in Molokai have a harder time of getting shipments of food. But they actually do have the resources when you look at it. It's just a matter of coordinating it, so it makes it part of the norm again. Because that's how a lot of people survived in a long time on Molokai.
Yeah.
So it's there. They just need to organize it.
Yeah.
It's really neat. Yeah.
So then, okay, I think you said this initiative you've been working on this initiative for 10 years?
Yeah, it's kind of evolved over a 10-year period.
That's great. And so it sounded like you started in public health, and you've
Yes.
kind of fallen into a food kind of system focus. Can you tell us a little more about that journey?
It's actually been kind of I did a lot of part-time work, just mainly because I was raising my kids, but my original background was in public health. And I wanted to go to law school so that I could deal with policy. But I think the time wasn't ripe. I think people now are a little bit more aware of policies and doing that kind of work on a greater basis. But I actually went back and did some work in tobacco prevention, which was a great model, because there you start to develop community organizing and targeting a specific industry, which is kind of what's happening now. And you work with community groups, and you start to change the whole paradigm of thinking about whether or not cigarettes and tobacco was healthy. And so we were able to flip that. And then what we did was deal with prevention. And now we're doing policies, and you work with youth and trying to prevent them from getting into smoking. So that same kind of thinking also transfers to food, except that food is a lot more complex. So it's a little bit hard to deal with, because it's not just one target, and there are a whole lot of different factors that are involved. There are people's emotions, people's culture, the things that are available, just different ethnic groups and different values. It's not as simple as cigarettes,
Right.
but the same theories apply.
Yeah.
So we're trying to implement that on a
It's an interesting
broader basis.
analogy where, you can look at something like cigarettes and it's been proven that there is some very addicting and just bad toxins in those products. And I can see where it's easier to show this is a problem, go
Don't
after
smoke.
it. Yeah.
But you can't say don't eat.
Right.
Exactly.
Yeah, and that's super fascinating too. And then even if you do have access to the right food, now you need to be preparing it. And that's a skill set in itself. And then timing and access to, so it's so many different things.
Yes, and I think part of our society has changed and made a lot more foods convenient, which aren't necessarily as healthy. And so I think what we're trying to do is get people to realize that, if you cook and use fresh fruits and vegetables, it's probably healthier for you. But it takes people a shift back to what was done before. And, we need to change our values and the way we see how we, eat at this time. Yeah.
And I like it looking at it the other way too, and part of what we do with Oahu Fresh and some of our thinking is how do we make it as convenient as possible to give access to these products, and I think kind of both ways. And we also try to where Justine will put up the recipe recommendations, and we realize a CSA model can only go so far, because here we are bringing it to your doorstep, but now there's still that additional step of they need to be using it. It needs to be items, if they're not familiar with it, maybe they're not going to use it, and then they lose interest. So
Right. We've kind of
it's
lost
combination of those two.
Yeah, we've kind of lost the art of cooking. So one of the things we found is you can present the fruits and vegetables, and a lot of times people don't know what to do with them.
Yeah.
And so that's why we also work with the culinary side. So we worked with KCC Culinary Arts Department, Daniel Leon,
Yeah.
created like a 6-week training course to train the trainer, train community people to go out and teach other people how to cook and to get them interested in cooking. It's the junior chef program that we're looking at right now. And so we're starting with youth. We did a train the trainer program for the leaders of the youth programs, and they created a competition amongst the kids in their organizations, and then we're putting together a competition. We started in the Kalihi area, a competition amongst those teams to come up with a top winner, just to kind of create that interest and
Yeah,
also get
for
parents
sure.
involved.
Yeah.
So we went from like 5 teams to like 9 teams last year. We're in our 3rd year. And next year we're looking to expand it statewide. So we're looking to work with the Big Island to see if they might be able to train some teams and get the kids interested. Because I think we need to make cooking and eating good food important again.
And
So-
fun. And I
and
think
fun.
that idea of targeting kids when we're talking about trying to like normalize something,
Right.
get that into their habits early
Right,
on.
right.
Yeah. So we have just a minute left. Is
Not
there
nearly enough time.
Never. No, let's go back to 45 minutes. Is there any, really quickly, the Junior Chef Challenge was an example of something you've kind of helped cultivate and promote. Is there anything coming up within the group that is worth?
So what we're also doing too with the YMCA, we're starting a youth empowerment program so that youth can also become leaders. And this is a program to get them started hopefully in the food and agricultural area to look at what kinds of things they can make food systems better. So we're doing that training and we're hoping to expand that. We brought in a consultant from California. The Y is piloting the program this year and they're hoping to expand their sites. So that's another piece, because to get youth involved, they're also part of this whole food
Yeah.
systems thing too, because they're the ones that can generate the interest and get other people in the community involved and to
Awesome.
better the food system.
Great. Well, great. We'll look forward to more information about that. Thank you
Okay.
so much for coming on and
Yeah, thanks,
sharing with
Gina.
us.
Thank you for having me.
All right.